Pathophysiology and Pharmacology of Cystic Fibrosis. Cystic fibrosis is a chronic progressive autosomal recessive disease. With over 2,000 mutations of cystic fibrosis transmembrane conductance regulator, or the CFTR protein, the most common mutation is found in patients with the CFTR protein gene is completely missing. When discussing the pathophysiology of cystic fibrosis, there are 5 class dysfunctions to examine. Class 1 relates to the frame shift or splice site mutation leading to a premature termination in mRNA sequencing. Through this termination, it fails to translate the genetic information into a protein, leading to a total absence of the CFTR protein. Class 2 is a result of an abnormal post-translational process of the CFTR protein. Due to the lack of this crucial step, the CFTR is unable to be moved to the correct cellular location. Class 3 is due to a diminished protein activity in conjunction to intracellular signaling. The outcome is a formed protein channel in the cellular membrane that is non-functional. Class 4 is when the protein is produced and correctly localized, but the rate of chloride ion flow and the duration of the channel activity is decreased. Finally, class 5 dysfunction relates to the net decrease in concentration of CFTR channels in the cell membrane due to a rapid degradation by the cell process. These mutations alter the stability of mRNA and mature CFTR proteins. As a consequence of all these mutations, a decreased secretion of chloride and an increased reabsorption of sodium form in the cell. As a result of the reabsorption of sodium, it leads to an increased water reabsorption, affecting how sodium and water move in and out of the cell. This then manifests into a thick mucus that accumulates in the airways, intestines, and pancreas. The most typical areas affected include sweat glands, pancreas, sinuses, lungs, hepatic system, and intestines. The most common manifestation of cystic fibrosis is the respiratory system. Cystic fibrosis becomes apparent in patients as a result of an infection, triggering the body's inflammatory response. The mucus obstructs the bronchioles, resulting in an optimal environment for bacteria growth within the airways, leading to poor lung ventilation and obstruction of airways. If poorly managed, pulmonary manifestations are the main cause of death in patients with cystic fibrosis. It also manifests in areas like the pancreas, which affects the pancreatic ducts that are obstructed by the thickened secretion. Due to this secretion, it inhibits the process of pancreatic enzymes being properly secreted in the body. It also allows for the sweat glands. It also affects the sweat glands. Under normal circumstances, the sweat glands move chloride from the extracellular space into the intracellular space, in turn, absorbing sodium and water into the tissues of the body. However, due to cystic fibrosis, this reabsorption process is obstructed, leading to excess fluid loss in the patient. Pharmacology. A common pharmacological management of cystic fibrosis is a triple combination drug, elexacaftor, tezacaftor, ivacaftor, frequently referred to as tricaftor. These CFTR modulators work to increase cystic fibrosis transmembrane conductance regulator proteins, in turn, aiding the responsiveness of CFTR proteins to function more effectively, improving the mortality and morbidity rates of cystic fibrosis in patients. When examining further, elexacaftor and tezacaftor work in union to improve the cellular processing and tracking, allowing for greater CFTR proteins to rise to the cell surface. If a catheter enhances the channel gating to the CFTR protein to the cell surface. When discussing Jacob as a healthcare professional, recommending this treatment would only be wise if he had the corresponding genetic mutation, meaning that he needs at least one F508del mutation in the CFTR gene. The common side effects linked to the medication can include rashes, headaches, and impact on liver function. However, these could all be closely monitored by nursing staff and laboratory staff. The route of this medication is easily taken by someone of Jacob's age and could aid their quality of life due to the positive feedback that this drug has received and accessibility of the route.